The intersection of human spirituality, compassion, and medicine in our digital age is one of the most profound challenges and opportunities of our time. As we move deeper into an era defined by artificial intelligence, data-driven diagnostics, and virtual care, the question isn't just about how we cure bodies, but how we preserve the soul of healing. Here are some reflections on how these forces interact. 1. The paradox of connectivity versus presence. Digital tools allow a surgeon in London to operate on a patient in rural Africa or a therapist to reach someone in a remote village via a smartphone. This is a form of digital compassion, breaking down barriers to care. However, there is a screen-deep paradox. Spirituality in medicine often resides in presence, the unspoken energy exchanged when a healer sits with a patient. In a digital world, we risk replacing eye contact with data entry. If a doctor spends 80% of a consultation looking at an electronic health record, EHR, rather than the patient's face, the spiritual connection, the feeling of being seen and known, is severed. 1. AI as a bridge to the human touch. Ironically, technology might be what saves human compassion in medicine. Currently, medical burnout is at an all-time high because doctors are treated like data processors. The hope. If AI can handle the clerical side of medicine, analyzing labs, transcribing notes, and suggesting diagnoses, it could theoretically free the human physician to return to the bedside. The goal: we use high-tech to allow for high-touch. Compassion requires time, and technology is the only thing that can give time back to the healer. 1. Healing versus curing, the spiritual aspect. In the digital world, we are very good at curing, fixing a biological machine, but often forget how to heal, restoring wholeness to a person. Medicine as a sacred right. Traditionally, medicine was seen as a spiritual calling. A patient isn't just a set of biomarkers. They are a story, a vessel of hopes, fears, and history. Digital reductionism. There is a danger in datification, viewing a human as a collection of metrics. Spirituality reminds us that the patient is greater than the sum of their data points. Compassion in a digital age means resisting the urge to treat the avatar or the chart, and instead reaching through the screen to acknowledge the human spirit. 1. Suffering and the limits of algorithms. Compassion literally means to suffer with. An algorithm can predict pain with 99% accuracy, but it cannot feel it. It cannot offer the ministry of presence. Spirituality in medicine recognizes that death and illness are not always bugs to be fixed in the code, but parts of the human experience that require companionship, ritual, and grace. A digital tool can provide a treatment plan, but only a human can provide the moral solidarity that tells a patient, "You are not alone in this." 1. Ethical compassion. The digital divide. From a spiritual perspective, compassion must be universal. In a digital world, we face the digital divide. If the most advanced, compassionate, AI-driven medicine is only available to the wealthy, we have failed a fundamental spiritual test of equity. True compassion in the modern age requires us to ensure that technology serves as a tool for justice, not just an upgrade for the few. The sacred algorithm. The future of medicine should not be a choice between the digital and the spiritual. Instead, we should strive for a digital humanics. We must use digital tools to solve the mechanical problems of the body, so that doctors and nurses can focus on the mystical problems of the human heart. Technology can provide the map, but the human spirit must remain the compass. In short, we must ensure that as our machines become more human-like, our humans do not become more machine-like.